So welcome guys to my YouTube channel. Today we'll be looking at the circulatory system. Basically we'll be looking especially the heart. So welcome to today's lecture. We'll be discussing about the heart. And the heart is usually a rough cone-shaped hollow muscular organ. It is about 10 centimeters long and about the size of a clenched fist. So in female it usually weighs about 225 grams, and in males weighs more about 310 grams. In terms of the position in the thoracic cavity, the heart is lies in the mediastinum between the lungs, and it lies obliquely towards more to the left than the right, and it has a base and an apex. So the base is usually on the superior part, and the apex is usually below. So the apex is usually towards the left side, and it's usually about 9 centimeters to the left of the midline, and towards also at the level of the fifth intercostal space, which is slightly below the nipple and usually slightly near the midline, and the base extends towards the second rib. Basically the organs associated to the heart: inferiorly we have the apex, which rests on the central tendon of the diaphragm. Superiorly we usually have the great vessels, especially the aorta superior vena cava, the aorta superior vena cava. We have the aorta and also the superior vena cava. And basically also the pulmonary arteries. We usually have many pulmonary artery and pulmonary veins, which now supply blood to the lungs for oxygenation and supplies back blood to the heart. So posteriorly it has organs, for example the esophagus and also the trachea, the left and right bronchus, and also the descending aorta on the posterior part. So this is the descending aorta on the posterior part. So this basically what lies on the posterior part, and especially also the inferior vena cava, So we usually have the inferior vena cava and the thoracic vertebrae. Laterally to the heart, it lies the lungs, the left lung, which overlaps with the side of the heart at the position lateral to the heart. Anteriorly, we usually have the sternum and the ribs and intercostal muscles. In terms of the structure of the heart, so in terms of this is when we are looking in terms of what lies to the in terms of the position. So you can actually see the superior part. You can see the great vessels. You can also see laterally the lungs and also the other lung. You can also visually see the anterior part. So the anterior part usually lies together with the sternum, lungs, and the intercostal. In terms of the structure of the heart, it composed of 3 layers. We have the pericardium, which is the outer fibrous tissue, and also the myocardium, the muscular layer, only found on the heart, and the endocardium, which is the inner side. So when we're looking at the pericardium, it's made of 2 sacs: the fibrous outer sac, which now encloses the heart. It is usually continuous with the tunica adventitia of the great vessels, that is the fibrous outer tissue. The inner sac continues in a double layer of serous membrane, whereby we have the outer layer of the serous membrane known as the parietal pericardium, which lies the fibrous sac. Also the inner layer, which consists of the visceral pericardium or epicardium, which is continuous with the parietal pericardium, which is the adherent to the heart muscles. Also the serous membrane consists of flattened epithelial cells, which secretes serous fluid into the space between the visceral and the parietal layer, which allows now for smooth pericardium only for potential space. The 2 layers usually they are in close association, whereby it allows a film of fluid to fill for to allow that when the heart pumps blood, it allows that space so that it can have a smooth contract. On the myocardium, which is the inner side, the mid layer of the heart, it consists of specialized cardiac muscles found only on the heart, and we already said that it is not usually under any voluntary control. And each fiber of the myocardium are specialized, especially when it comes to its function. It only has 1 nucleus and 1 or more branches of the fibers. So in terms of its impulse, when they are initiated, it spreads through these their branches via the intercalated discs, which are usually found on the myocardium, over whereby the muscles contraction can be spread through from one branch to another because of that intercalated disc, which now overlay over. So the sheet of that myocardium membrane usually, or myocardium, is usually arranged in from atria to ventricle, so that it can, when a contraction is initiated on the atria, it can also be coordinated efficiently in a manner to the rest of the ventricles. So you can see the thickness of the usually thicker on the apex actually, and the thins on the base. So it usually thin on the base and more thick on the apex, so that it can reflect the amount of blood or the work which each chamber contributes when it comes to the pumping action. So the thicker part usually on the apex aids for the pumping blood to the systemic circulation. So it's in association with what the work it does. So basically the apex is usually thicker and the base is usually thin. So between the atria and the base, we usually have a septum which separates between the two chambers. So in between the atria and ventricles, we usually have a ring of fibrous tissue which does not conduct any electrical activities. And when we have a wave of electrical activity passing from atria to muscles to the ventricle muscles, they spread through the ventricles through a conducting system which bridges between the fibrous rings inside the atria and ventricles. Then on the inner side of the muscles layer, it is known as the endocardium, which forms the lining of the myocardium and the heart valves. So it's usually thin and smooth, and usually have a glistening membrane which permits the blood flow from or flow of blood or smooth flow of blood from inside the heart. It usually consists of flattened epithelial cells, which is continuous with the endothelium of the lining of the blood. So basically, the heart consists of two receiving chambers and two pumping chambers. So when we say two receiving chambers, we are looking at what happens when it comes to blood flow. So all the blood flow from the rest of the body goes to the right. Goes to the right side of the heart, which is the atria, goes to the right atria. Then the blood is pumped to the left ventricle. So from the left ventricle, the right ventricle goes to the lungs through the pulmonary trunk. So we usually have a pulmonary trunk or pulmonary arteries which pumps blood from the right ventricle to the lungs. Then blood that is oxygenated then flows back to the heart through the pulmonary veins, then into the right atria, then to the left ventricle where blood is pumped to the rest of the body. Basically, this is the what happens when it comes to pumping chambers. So all the chambers usually coordinate when it comes to pumping. So interior to the inside side of the heart is usually lined with basically a septum which divides the right and the left side of the heart. So each side of this heart is usually divided by valves. So basically, you have the atrioventricular valves, known as where we have it divides the atrium from ventricles. So, for example, the right side of the heart is that is the right auricle is divided or as a valve known as the tricuspid valve, which has three valves. Cups. So it has three valves or cups. That's the name. The tricuspid, tri means three, so meaning that it has three valves. Cups or flaps. Then the left side usually have two valves known as bicuspid or sometimes known as the mitral. So on the right side, the left side usually have mitral, the right side has the tricuspid because of that three valves cups or flaps which are usually found between the atria and the ventricle. So between the atria and the ventricle, we usually have a valve which separates or block the inflow or backflow of blood from the ventricles back to the atria. So meaning that it prevents the backflow. So meaning when we have blood is pumped from the right auricle to the left to the right ventricle, it allows passage, then it prevents the backflow of blood to the right auricle when we are pumping blood to the heart, to the lungs. So we usually have this pulmonary vein which now takes blood to the lungs. And also we usually have other valves, the semilunar valves, which now we have the aortic valve, which is now prevents backflow of blood from the atria. From the that is the aortic valve, which now prevents backflow from the aorta back to the left ventricle, so that prevents blood. Then on the right side of the heart, we usually have a pulmonic valve, so which prevents backflow of blood from the lungs towards the right ventricle. So this is basically what usually happens when it comes to valve. So also on the valve, they usually have special cords known as tendinous cords known as corda tendinae, which now prevent the valve from opening outside when the pressure inside the ventricles are higher than auricle. So it prevents that extent in which you can have the opening upwards of the ventricles, the valves into allowing now blood into the auricles. So we usually have cordia tetani and also the papillary muscles, which is covering the endothelium side of the myocardium, with projections on those caps, meaning that it prevents backflow of blood. So when it comes to flow of blood, so blood flows from superior vena cava and inferior vena cava on the inferior part. Then it flows to the right ventricle. From the right ventricle to the from the right auricle to the right ventricle, we usually have a valve, the arterioventricular valve, or sometimes known as the right and the arterioventricular valves, or the tricuspid valves. Then as blood fills the right ventricle, blood is pumped to the lungs through the pulmonary valve, pulmonary artery, which is guarded by the pulmonary valve. Then in the lungs, oxygenation takes place. Then blood that is rich in oxygen flows back to the the left auricle through the pulmonary veins. Then blood flows to the right ventricle, the left ventricle through a mitral valve or bicuspid valves. Then blood from the right ventricle, left ventricle, flows back to the rest of the body through the aorta, whereby we have bifurcations of the aorta. So the aorta divides into three chambers. We usually have the first one, which is the bronchocephalic trunk. This is the bronchocephalic trunk, then followed by the common carotid artery, then subclavian artery. So it divides more as it enters. Then it goes to the descending aorta, which now divides more. So also in between the before the bifurcations of the branches of the aorta, we usually have a specific blood vessels that supply to the heart muscles. So we usually have the coronary arteries inside. So we usually have the coronary arteries, as you can see these small branches. So pulmonary arteries, coronary arteries divides into right and left. So from the branch of the aorta, we usually have, before the bifurcation of the branches, we usually have a special blood vessels known as the coronary arteries, which divides into right and left, supplying the right side of the heart and the left side of the heart. So basically on the right and the left coronary arteries, which branch from the aorta immediately before the immediately on the distal to the aortic valve. So in the distal of the aortic valve, we usually have the coronary arteries, and all the branches from the right and left coronary arteries branches more. So the right side usually does not have any branch, but it have small branches until it reaches the marginal branch. So it reaches the marginal branch here. We can see the marginal branch of the right coronary artery, which now supplies to the rest of the ventricles. Also, you can see on the right, the right ventricle auricles. Then on this side of the left auricle and ventricle, it has some small, special branches. So first, it divides into the left auricle by a special artery known as the circumvallate or circumflex branch of the coronary artery. Then as it branches to smaller tiny arterioles, the branch also branch more into anterior intraventricular branch of the coronary artery. Then it goes to the diagonal branch of the intraventricular branch towards the ventricle. So usually have a small branches on the left. So on the left side, this is the left branch. It goes to the circumflex branch of the left ventricle, then also to the anterior intraventricular branch of the coronary arteries, then supplying the rest of the heart muscles. So a little bit of the conducting system. What usually happens when we say that the heart muscles usually does not have any voluntary conducting system, whereby it initiates its own electrical activity and beating independently of the nervous and hormonal control. So however, the intrinsic system usually is stimulated or repressed by nerve impulses, which are the parasympathetic and sympathetic nerve control, especially the autonomic nervous system, which initiate the brain and also the circulating chemicals, including the hormones. So there are usually specialized cells inside the heart, which are responsible for generation of the and coordination of the transmission of electrical activities, which enables the heart to pump independently. So we usually have some special cells, the conducting cells. The sinoatrial node is one of the cells which is very important. It's usually the primary pacemaker when it comes to firing the electrical activity. So this is the first, usually the fires faster than any other cell. So basically it's located basically on the junction of the superior vena cava, the junction between the superior vena cava and also the right atrium. So between the right atrium and the superior vena cava, they are usually located there, inside on the inner side. And number two, the second one is the arterioventricular node, the AV node, which is located in the right auricle, right atria, and the wall near the tricuspid valve. So remember the tricuspid valve where we have the they prevent the backflow of blood from the right ventricle to the right auricle. So it coordinates the incoming electrical impulse from the atria after a slight delay. Usually have a slight delay, which is usually explained why we have a slight delay between the electrical activity between the atriums or the atria and the ventricles. So that slight activity allows the blood to fill the vessels, the chambers of the heart. So normally the firing rate at the ventricular level is slightly lower at around 40 to 60 impulses rather than the sinoatrial node, which is usually higher, between 60 to 80 impulses per minute. So then it branches to smaller branches. From the atrioventricular node, it branches to atrioventricular bundles known as the bundle of His or the AV bundle, which originates from the AV node. Then from the AV node, it branches on the upper side of the ventricle septum, which divides on the right and left bundle branches. Then as it branches through the septum, it forms the Purkinje fibers. So Purkinje fibers form within the ventricular myocardium, which are the ventricular sides on the lower sides. Then the AV node now branches more into Purkinje fibers, which convey the electrical impulse from the AV node to the apex of the heart, where we have the myocardium, and also conducting the ventricular contractions begins, and also it sweeps upwards. So it sweeps usually upwards on either side, so that it allows the pumping blood into the pulmonary arteries and the aorta, so that it can have that action coordinated. So the nerve supply to the heart is usually basically the parasympathetic and sympathetic, which have antagonistic actions. So basically from the vagus nerve, which is a parasympathetic supply, mainly supplies the sinoatrial node and the AV node, and also the atrial muscles. The sympathetic nerve usually coordinates the myocardium of the atria and the ventricles, which stimulates the force of contraction, increasing the rate and force of the heartbeat. So sympathetic usually increases the act on the sinoatrial node and also the AV nodes, which stimulate, and also the myocardium of the atrial ventricles, which stimulate the rate and the force of. So the cardiac cycle usually opens in 3 stages. So usually have the stages of cardiac cycle. So cardiac cycle, these are series of events which occur when the heart acts as a pump. So during the heartbeat, cardiac cycle, the heart contracts, then relaxes. So we call it the cardiac cycle, when heart beats and relaxes. So the normal cardiac cycle for per minute usually ranges between 60 to 80, which is basically an average of 74 beats per minute. So the cycle usually have or lasts for at least 0.8 seconds and usually consists of the atrial. So usually have the atrial systole, which is the atrial contraction, then ventricular contraction, and a complete cardiac distole, where we have the relaxation both of the atrium and the. Also, sometimes we usually have heartbeats or heart sounds which are produced when the heart beats. So heartbeat is heard when we have contraction or what is happening inside the left and the right ventricles. So the heart sounds can be heard in 4 osculatory chambers. Usually we have the aortic area, which is found in the second intercostal muscle, intercostal space right to the sternum. So usually heard the aortic on the right side, basically on the right side towards the right, because where the aorta is positioned, where we have the aorta. Then usually have the pulmonic area, which usually on the same second intercostal space, but usually on the right. On the left of the sternum, basically on the right, on the left. Then the tricuspid area, which is known as sometimes tricuspid area, which is found between the 4th and 5th intercostal space on the left lower border of the sternum. The mitral or the apical area, sometimes known as the point of maximum impulse, is found on the 5th intercostal space left to the midclavicular line. So we usually had this part on the 5th intercostal space and the left midclavicular